Properly moving a patient from where they were found and then to the ambulance needs to be accomplished on most EMS calls. In most cases, this is done slowly and carefully. In some serious patients, the lifts may need to be done very quickly to move the patient out of harm's way. In all situations, it is necessary for the EMT basic to understand which would be the best means of lifting the patient, how to use the device chosen to remove the patient to the ambulance, and how to use good body mechanics to minimize the potential injury to themselves or their partners. In this video, we will discuss the types of lifts and moves, as well as tips to help you safely lift and move your patient. First, it is essential that the EMT basic understand body mechanics. Body mechanics is the proper use of the body to prevent injury and to facilitate lifting and moving of the patient. Prior to lifting any object, consider the following: the patient's weight. Will additional assistance be required? What are the physical lifting abilities of you and your partner? Plan how you will accomplish the lift and communicate it. Another important aspect of body mechanics involves following a few simple rules when lifting. Position your feet on a firm surface and shoulder width apart. Use your legs, not your back, to lift. Do not lean over and compensate when lifting with only one hand. Keep the weight as close to your body as possible. Rather than carrying a stretcher or reeves downstairs, use a stair chair. EMT basics can be prone to injury when they are placed in a position where they are reaching, pushing, or pulling. To prevent injury when reaching, the EMT basic should keep your back in a locked-in position. Avoid twisting while reaching. Avoid reaching more than 20 inches in front of you. And avoid a prolonged reach when a strenuous effort is necessary. When pushing or pulling, the EMT basic should try to push rather than pull when practical. Keep your back in a locked-in position. Keep the line of the pull through the center of your body by bending your knees. Keep the weight close to your body. Avoid pushing or pulling overhead. And keep your elbows bent and arms close to your sides. To prevent injury when lifting patients, the EMT basic should try to use the power lift and the power grip. The power lift involves squatting rather than bending at the waist and keeping the weight as close to you as possible. The power grip involves using as much of the area surface of your hands and palms as possible. All fingers should be bent at the same angle. The palms should be up underneath the object you are lifting, and the two hands should be at least 10 inches apart. There are three classifications of moves: emergency moves, urgent moves, and non-urgent moves. An emergency move is done as fast as possible with little regard for spinal integrity. An example would be a situation where the car is on fire and the patient needs to be immediately removed. An urgent move needs to happen very quickly, but there is time to be cautious and not aggravate a potential spine injury. An example would be the rapid extrication technique used for the critical trauma patient found in a seated position in an automobile. A non-urgent move is used for the majority of moves, and it is used for patients when there is no immediate threat to life or limb. Usually, the patient is assessed and managed prior to the movement, as is the case of assisting a cardiac patient with chest pain onto the stretcher.